Welcome to Informative Zone, a place where we focus on real, practical health guidance that speaks directly to everyday problems many seniors face. If you are watching this because your feet feel like they are burning, tingling, or on fire, especially when you lie down at night, you are not alone. Millions of people over the age of 60 experience this exact problem, and for many, it becomes worse in the evening, interrupting sleep and making rest almost impossible. Tonight, I want to walk you through a simple, natural approach that has helped countless people calm that burning sensation quickly, often in as little as 5 minutes. This is not a complicated treatment, and it does not require expensive equipment, prescriptions, or medical procedures. It is something you can do safely at home, with items that are easy to find and simple to use. My name is Dr. Warren, and I want to begin by saying something important. Burning feet are not just an annoyance. They are a signal from your body. Too often, people are told to ignore the sensation, endure it, or accept it as part getting older. That belief causes unnecessary suffering. While it is true that changes in the body occur with age, discomfort does not have to control your quality of life. Understanding what is happening and responding appropriately can make a meaningful difference. In this discussion, I will explain why burning foot pain becomes more common after 60, what is actually happening inside your body, and how a simple rubbing technique using a specific oil can bring fast relief when used correctly. Before we talk about solutions, let's talk about the experience itself. Burning feet are often described in different ways. Some people say it feels like heat radiating from the soles. Others describe pins and needles, sharp tingling, or a deep aching warmth that does not go away. For many, the sensation becomes strongest at night. During the day, movement and distraction can mask discomfort, but when you finally lie down, the pain seems to grow louder. This can make falling asleep difficult and staying asleep even harder. Over time, poor sleep affects mood, energy, balance, and overall health. That is why addressing this issue is not just about comfort. It is about protecting your well-being. So why does this happen more often after 60? One major reason is nerve sensitivity. As we age, nerves can become less efficient at sending and receiving signals. Sometimes they misfire, sending pain messages even when there is no immediate injury. This is often referred to as peripheral nerve irritation. Circulation also plays a role. Blood flow to the feet can slow down with age, especially if you spend long periods sitting or standing. When nerves do not receive enough oxygen and nutrient from healthy circulation, they can become irritated and reactive. Swelling is another factor. Fluid tends to pool in the lower legs and feet, especially later in the day, placing pressure on surrounding nerves and tissues. Certain health conditions can increase the likelihood of burning feet. Diabetes is one of the most common, as it can affect nerve function over time. Vitamin deficiencies, particularly B vitamins, can also contribute. Some medications list burning or tingling sensations as side effects. Even footwear choices matter. Tight shoes and socks can restrict circulation and increase nerve irritation. Often, burning feet are not caused by one single issue, but by a combination of factors working together. This is why gentle, supportive approaches that address circulation, nerve comfort, and swelling can be so effective. Now, let us talk about relief. The method I am sharing today centers around peppermint essential oil, used properly and safely. Peppermint oil contains menthol, a natural compound known for its cooling and soothing effects. When applied to the skin in a diluted form, menthol interacts with sensory receptors that influence how pain is perceived. Instead of feeling heat and burning, the brain receives a cooling signal. This does not mean the nerves are being numbed or damaged. Rather, the sensation is redirected, helping calm overactive nerve signals. This is why the relief can feel almost immediate for many people. Peppermint oil also supports circulation when used with gentle massage. Rubbing the oil into the feet encourages blood flow to the area. Better circulation means more oxygen delivery to irritated nerves and improved removal of excess fluid that contributes to swelling. When these effects combine, the result is a noticeable reduction in discomfort. This is not about masking symptoms in a harmful way. It is about supporting the body's natural responses and creating an environment where nerves can settle down instead of constantly firing distress signals. It is very important to emphasize that peppermint essential oil must never be applied directly to the skin without dilution. Essential oils are highly concentrated plant extracts. Used incorrectly, they can irritate or damage the skin. That is why a carrier oil is required. A carrier oil dilutes the essential oil, allowing it to be spread safely over a larger area while still delivering its benefits. Coconut oil is a popular choice because it absorbs well and is gentle on the skin. Olive oil is another excellent option and is often already in the kitchen. Sweet almond oil or jojoba oil also work well. The specific carrier oil is less important than proper dilution. Prepare the mixture. You will need 2 tablespoons of your chosen carrier oil. To that, add 5 to 6 drops of pure peppermint essential oil. Look for a product labeled 100% pure essential oil, without added fragrance oils or synthetic ingredients. Quality matters, but expensive branding is not required. Mix the oils gently in a small bowl until combined. The mixture may appear slightly cloudy, which is normal. Once mixed, it is ready to use. You can prepare it fresh each time or make a small batch to store in a dark glass container for short-term use. Before applying the oil, there are a few simple steps that can improve the results. One of the most effective is elevating your feet for about 10 minutes. Throughout the day, gravity causes fluid to collect in the lower legs and feet. Elevation allows that fluid to move back toward the heart, reducing pressure in the feet. Less pressure means less irritation of the nerves. Simply lying down and placing a couple of pillows under your feet is enough. This step alone can reduce discomfort, and when combined with the oil application, it can enhance the overall effect. Hydration is another overlooked factor. When the body is dehydrated, blood circulation becomes less efficient. Thickened blood does not flow as easily through small vessels, including those in the feet. This reduces oxygen delivery to nerves and increases sensitivity. Drinking adequate water throughout the day supports circulation and nerve health. Aim for several glasses spread across the day rather than large amounts at once. Herbal teas can count toward fluid intake, but excessive caffeine and alcohol should be limited, as they can worsen dehydration. Footwear also matters more than many people realize. Tight socks and shoes restrict circulation and compress nerves. If your socks leave deep marks on your skin, they are too tight. Shoes should allow your toes to move freely without pressure. Giving your feet space allows blood to flow more easily and reduces ongoing irritation. Whenever possible, spend time barefoot at home or wear loose, supportive slippers to allow your feet to relax. Now, let us talk about how to apply the oil properly. Technique is important. Begin by sitting comfortably in a chair with good support. Place a towel nearby to protect surfaces. Pour about a teaspoon of the oil mixture into your palm and rub your hands together for several seconds. This warms the oil slightly, helping it absorb more effectively into the skin. Cold oil tends to sit on the surface, while warm oil penetrates more deeply. Start with the toes. Place your hands on the top of your foot and massage gently in slow, circular motions. Apply firm but comfortable pressure. Make sure to work between each toe, as tension can build there. Spend at least 30 seconds on this area. Move next to the ball of the foot, using your thumbs to apply circular pressure. This area often carries a lot of stress from standing and walking. Take your time and work across the entire width of the foot. Next, focus on the arch. Use steady pressure along the length of the arch, moving from the ball of the foot toward the heel. If you find a spot that feels particularly sensitive or warm, pause and apply gentle pressure for several seconds. This can help release tension and allow the oil to work more effectively. Move on to the heel, applying circular motions and slightly firmer pressure, including the sides of the heel where nerve endings are present. Finish by massaging around the ankle using gentle movements. This helps improve circulation through the entire foot. The full massage should take about 2 to 3 minutes per foot. Within 5 minutes of finishing, many people notice a cooling sensation and a reduction in burning discomfort. The feet may feel lighter, calmer, and less swollen. This method can be used once or twice daily, depending on your needs. Many people find that using it before bed significantly improves sleep quality. As we close this first part, remember this: burning feet are common, but they are not something you must simply endure. Gentle, informed care can bring real relief. In the next part, we will go deeper into nighttime nerve behavior, safety considerations, and how consistent use can support longer-term comfort. Stay with Informative Zone as we continue today. As we continue here on Informative Zone, it is important to slow down and really understand what happens in your body when burning foot pain becomes worse at night. Many people ask why their feet seem manageable during the day, yet feel unbearable once they lie down. This pattern is extremely common, and there are clear reasons for it. During the day, your nervous system is constantly processing movement, sound, light, and activity. These competing signals can partially distract the brain from pain messages coming from the feet. At night, when everything becomes quiet and still, the brain has fewer distractions. As a result, it becomes more aware of discomfort, and nerve signals that were once tolerable suddenly feel intense and overwhelming. Another factor is circulation. When you lie flat, blood flow patterns change. In some people, especially older adults, circulation to the lower extremities can become less efficient in this position. This reduced flow can increase nerve sensitivity and make burning sensations feel stronger. Swelling that builds up during the day may also take time to resolve, especially if the legs were not elevated earlier. All of these factors combine to create the frustrating nighttime flare-ups so many people describe. This is why timing matters when using the peppermint oil remedy. Applying it in the evening, after elevating your feet and allowing some swelling to decrease, often produces the strongest relief. The cooling sensation from menthol can interrupt those amplified nighttime nerve signals and help the body shift into a calmer state. Many people notice that once their feet settle, the rest of their body relaxes more easily, making it simpler to fall asleep and stay asleep. Now let us talk about consistency, because this is where many people either succeed or give up too soon. One application can bring relief, but repeated daily use supports more stable comfort over time. When irritated nerves are repeatedly soothed, they tend to become less reactive. Swelling that is managed regularly is less likely to reach extreme levels. Circulation that is encouraged daily remains more consistent. This does not mean the oil is curing a medical condition. It means you are supporting your body in a way that reduces triggers for discomfort. Many people report that after a week of consistent use, their burning sensations return less frequently and with less intensity. Safety must always remain a priority. Peppermint oil is powerful. That power is what makes it effective. But it also means it must be respected. Always dilute it properly with a carrier oil. Never assume that more oil means faster relief. In fact, using too much peppermint oil can irritate the skin and worsen discomfort. 5 to 6 drops per 2 tablespoons of carrier oil is sufficient. If your skin is sensitive, you can use fewer drops. Everyone's skin responds a little differently, so paying attention to how your body reacts is essential. A patch test is strongly recommended before first use. Apply a small amount of diluted oil to the inside of your wrist and wait 24 hours. If there is no redness, itching, or irritation, it is generally safe to proceed. This simple step can prevent unnecessary reactions. Also, never apply the oil to broken skin, sores, or areas with reduced sensation unless your healthcare provider has approved it. People with diabetes or advanced nerve damage should always consult their doctor before trying new topical treatments, even natural ones. Hand washing after application is another important detail that is often overlooked. Peppermint oil can cause a strong burning sensation if it comes into contact with the eyes or other sensitive areas. Wash your hands thoroughly with soap and water after massaging your feet. Avoid touching your face until your hands are clean. These small precautions make a big difference in ensuring a positive experience. Some people ask whether peppermint oil loses effectiveness over time. When used properly and stored correctly, its benefits remain consistent. Keeping the mixture in a dark glass container away from heat and light helps preserve its quality. If the scent changes significantly or the oil becomes cloudy in an unusual way, it is best to prepare a fresh batch. Freshness supports both effectiveness and skin safety. IT is also helpful to understand what this remedy is not doing. It is not numbing the nerves in a harmful way. It is not damaging nerve endings. It is not interfering with your body's ability to sense temperature or pain long-term. Instead, it is influencing how pain signals are perceived while supporting circulation and comfort. This distinction matters, especially for seniors who may worry about masking symptoms. The goal here is comfort and support, not suppression or harm. Let us also discuss alternatives briefly, because not everyone can use peppermint oil. Lavender essential oil is known for its calming properties and can help reduce discomfort when diluted and applied in the same way. Eucalyptus oil offers a cooling sensation similar to peppermint and may support circulation. These options do not typically provide relief as quickly as peppermint, but they can still be helpful. The same safety rules apply. Always dilute, patch test, and avoid broken skin. Another supportive step that many people find helpful is wearing loose cotton socks after applying the oil. This helps keep the oil in contact with the skin longer and prevents it from transferring to bedding or furniture. The socks should be breathable and not tight. Tight socks defeat the purpose by restricting circulation. Soft cotton allows warmth without compression. Some individuals choose to soak their feet in warm water with Epsom salt before applying the oil. This step can help relax muscles and reduce swelling. Warm water opens pores, allowing better absorption of the oil afterward. If you choose to do this, limit soaking to about 10 minutes and dry your feet thoroughly before applying the oil. Damp skin does not absorb oil effectively, and moisture trapped under oil can irritate the skin. A common question is whether this remedy can be overused. In general, applying it once or twice daily is safe for most people. If you notice dryness or irritation, reduce frequency or increase the amount of carrier oil in the mixture. Listening to your body is key. More frequent application is not always better. Balanced, consistent use tends to produce the best results. For those who have difficulty reaching their feet due to flexibility or back issues, assistance tools can help. A small massage roller or even a tennis ball can be used to gently massage the oil into the soles. Place the ball on the floor, rest your foot on it, and roll slowly back and forth. This allows you to apply pressure without bending. Asking a trusted family member for help is also a reasonable option. There is no benefit in straining yourself to perform a massage. As we wrap up the second part, remember that burning foot pain is influenced by multiple factors. Addressing circulation, swelling, nerve sensitivity, and daily habits together produces the strongest results. In the next part, we will talk more about long-term comfort strategies, realistic expectations, and how to recognize when additional medical guidance is needed. Stay with Informative Zone as we continue building a complete understanding of this issue and its management. Welcome back to Informative Zone as we continue this in-depth discussion about burning foot pain and how seniors can manage it safely and effectively. In this part, we're going to focus on long-term comfort, realistic expectations, and understanding what your body is communicating to you over time. While fast relief is important, especially when pain interferes with sleep, lasting improvement comes from awareness, consistency, and knowing when to adjust your approach. This is where many people feel uncertain, so it is important to talk through it carefully and clearly. First, let us address expectations. The peppermint oil method you are learning about is designed to bring relief, not to promise a cure. Burning feet often develop over years due to gradual changes in nerves, circulation, and tissue health. Expecting one treatment to permanently eliminate symptoms overnight can lead to disappointment. However, expecting improved comfort, reduced intensity, better sleep, and greater control over symptoms is realistic. Many seniors report that once they understand their triggers and use supportive care consistently, their quality of life improves significantly. One of the most important long-term strategies is observation. Pay attention to patterns. Notice when the burning sensation appears, how long it lasts, and what seems to make it better or worse. Some people notice that symptoms flare after long periods of sitting. Others feel worse after standing for too long. Certain foods, dehydration, or poorly fitting shoes may also play a role. Keeping mental notes or even writing these observations down helps you make informed adjustments. The more you understand your body's patterns, the better you can respond before discomfort escalates. Consistency with gentle care is another key factor. Using the peppermint oil mixture once or twice daily creates a routine of attention and support for your feet. This routine does more than apply oil. It encourages circulation through massage, reduces swelling through elevation, and signals to your nervous system that it is safe to relax. Over time, repeated calming signals can help reduce the frequency and intensity of nerve misfiring. This does not happen instantly, but it does happen gradually for many people. It is also important to understand that burning foot pain can fluctuate. Some days will be better than others. Weather changes, activity levels, stress, and sleep quality all influence nerve sensitivity. A flare does not mean failure. It simply means your body needs extra care that day. Responding calmly instead of with frustration helps prevent tension, which can actually worsen pain perception. The goal is management, not perfection. Now let us talk about the role of stress and the nervous system. Chronic discomfort often creates anxiety. Anxiety increases muscle tension and nerve sensitivity, forming a cycle that keeps pain active. Gentle foot massage using the oil can break that cycle. The physical touch combined with a cooling sensation sends calming signals to the brain. This is one reason why many people find the remedy especially helpful at bedtime. It becomes part of a calming ritual that prepares the body for rest. Sleep itself is essential for nerve health, so anything that improves sleep indirectly supports recovery. Posture and movement during the day also matter. Sitting with feet flat on the floor for long periods can restrict circulation. When possible, shift positions, stretch your ankles, and move your toes. Simple movements encourage blood flow and prevent fluid buildup. When standing, avoid locking your knees. Small adjustments reduce strain on the lower legs and feet. These changes may seem minor, but over time they add up. Another important aspect is footwear choice beyond just tightness. Shoes should provide support without compression. Cushion soles can reduce impact stress on the feet. Breathable materials help regulate temperature, which can influence burning sensations. Avoid shoes that trap heat or moisture for long periods. At home, supportive slippers with room for the toes are often better than walking barefoot on hard surfaces, especially for those with sensitive feet. Now let us address when additional medical guidance is appropriate. While burning feet are common, persistent or worsening symptoms should not be ignored. If pain becomes severe, spreads rapidly, or is accompanied by weakness, numbness, or changes in skin color, medical evaluation is important. Open sores, infections, or significant loss of sensation require professional care. The peppermint oil method is supportive, not a replacement for medical treatment when serious conditions are present. For individuals with diabetes, regular foot checks are essential. Reduced sensation increases the risk of unnoticed injuries. Always inspect your feet daily for cuts, blisters, or redness. If vision or flexibility makes this difficult, ask for help. Apply oils only to healthy, intact skin. Communicating openly with your healthcare provider about any home care methods you use helps ensure safety and coordination of care. Another topic that often comes up is aging and acceptance. There's a difference between accepting change and surrendering comfort. Aging does not mean giving up on feeling well. It means adapting with knowledge and compassion. Gentle remedies, supportive habits, and informed choices allow you to maintain comfort and independence longer. Burning feet do not define you, and they do not have to control your evenings or nights. Let us also discuss patience. Many people try a remedy once or twice and stop if results are not dramatic. While some feel immediate relief, others notice gradual improvement. Skin, nerves, and circulation respond at different speeds. Giving your body time to respond is an act of self-respect. Consistency over a week or two provides a clearer picture of how effective the method is for you. Community support matters too. Talking about discomfort helps reduce isolation. Many seniors suffer quietly, believing they are alone. Sharing experiences with trusted friends or family can provide reassurance and practical tips. Even simple conversations reduce stress, which can indirectly ease symptoms. Knowing that others understand what you are experiencing is powerful. As we approach the end of this part, it is important to return to the central message. Burning foot pain is common, but it is manageable. Simple, safe, natural approaches can bring meaningful relief when used thoughtfully. The peppermint oil method works best as part of a broader pattern of care that includes hydration, movement, proper footwear, stress reduction, and awareness. When these elements come together, comfort becomes more consistent and predictable. In the final part, we will bring everything together, reinforce the most important points, and talk about building a sustainable routine that supports comfort and confidence moving forward. Stay with Informative Zone as we complete this discussion and help you feel more in control of your health and daily comfort. As we come to the final part here on Informative Zone, I want to bring everything together in a clear, grounded, and reassuring way. By now, you understand that burning foot pain after 60 is not random, and it is not something you simply have to endure in silence. It is a result of real, understandable changes in nerves, circulation, swelling, and daily habits. When you address those factors gently and consistently, relief becomes possible. This final part is about creating a sustainable routine, building confidence in what you are doing, and knowing how to move forward without fear or confusion. Let us start with routine, because routine creates stability for the nervous system. When your body knows what to expect, it relaxes more easily. A simple daily pattern can make a significant difference. This might include drinking water regularly throughout the day, avoiding long periods of stillness, wearing comfortable footwear, and setting aside a few minutes in the evening for foot care. These actions do not need to be complicated. In fact, the simpler they are, the more likely you are to continue them. The peppermint oil massage fits naturally into this routine because it is quick, calming, and effective. Think of the massage not just as a treatment, but as a signal. When you sit down, elevate your feet, and gently apply the oil, you're telling your body that it is time to rest. This signal travels through the nervous system. Muscles loosen. Breathing slows. Tension eases. This is especially important at night, when the body transitions from activity to rest. Many people find that once their feet calm down, their entire body follows. This is why addressing foot discomfort can have benefits far beyond the feet themselves. Confidence is another important element. Pain often creates doubt. People begin to question their bodies, wondering if something is seriously wrong or if discomfort will keep getting worse. Knowledge replaces fear with understanding. You now know why burning sensations occur, why they worsen at night, and why cooling, circulation support, and gentle massage help. This understanding allows you to respond with intention instead of panic. When discomfort appears, you know what to do. That sense of control is powerful. It is also important to recognize progress, even when it is subtle. Relief does not always arrive as a dramatic change. Sometimes it shows up as falling asleep faster. Other times it means waking up less often, or noticing that the burning sensation fades more quickly than before. These are meaningful improvements. Acknowledging them reinforces consistency and patience. Healing and comfort are rarely instant, but they are often cumulative. Another key part of sustainability is flexibility. Life changes. Travel, illness, schedule shifts, and stress can interrupt routines. When that happens, it does not mean you have failed. It simply means you return to your supportive habits when you can. The peppermint oil method does not require perfection. It requires intention. Even occasional use during flare-ups can provide relief and reassurance. Let's talk briefly about mindset. Chronic discomfort can wear people down emotionally. Frustration, irritability, and hopelessness are common responses. These emotions are understandable, but they can also increase pain sensitivity. Choosing to approach care with kindness instead of anger helps break that cycle. When you massage your feet, do it slowly. Breathe. Allow the cooling sensation to be something you notice and appreciate. This mindful approach supports relaxation and improves results. It is also worth revisiting the importance of communication with healthcare providers. Using a natural topical remedy does not mean you are rejecting medical care. It means you are participating actively in your own comfort. Let your doctor know what you're using, especially if you have diabetes, circulation issues, or nerve conditions. Open communication ensures safety and coordination. Most providers appreciate when patients take thoughtful steps to manage symptoms responsibly. As we close, I want to emphasize something very important. Aging does not mean surrendering comfort. It means learning new ways to care for a changing body. Burning feet are common, but they are not a sentence. With gentle, informed care, many seniors experience real relief and better sleep. The peppermint oil method is simple, affordable, and accessible. When combined with elevation, hydration, movement, and proper footwear, it becomes part of a comprehensive approach to comfort. Imagine lying down at night without dread. Imagine feeling your feet cool and relax instead of burn. Imagine waking up more rested and less tense. These are not unrealistic hopes. They are achievable outcomes when you apply what you have learned consistently and patiently. Your body is capable of responding positively when given the right support. Thank you for spending this time with Informative Zone. Our goal is always to provide practical, trustworthy guidance that respects your experience and supports your independence. If this information has been helpful, remember that small actions practiced daily often lead to the biggest changes. Take care of your feet, take care of your rest, and take care of yourself. You deserve comfort, and you deserve peace at the end of your day.